Okay, Angela's story, a case study on the reproductive system. You are a columnist for a popular website that deals with women's health issues. Visitors to the site can submit their stories and questions through an Ask the Expert link on the site. In this scenario, a 26-year-old woman has posted her story and some questions regarding reproductive health. My name is Angela. I'm a 26-year-old married woman with no children. My husband, Doug, and I have been trying to get pregnant for over 2 years now, and my doctor has suggested that I consider fertility drug treatments. The irony of our situation is that I have been taking a birth control pill for 5 years to prevent getting pregnant, and now my doctor suggests that I take another drug to help me get pregnant. When I went off birth control about a year ago, my menstrual cycle became very irregular. I had been taking a birth control drug called orthotricycline. To be perfectly honest, I don't understand how it works because my periods were more regular when I was on the pill than when I went off of it. My doctor told me that the pill works because it tricks your body into thinking that it is pregnant. That just confused me even more. Let me scroll down a bit. When I looked back on my decision to take birth control pills, I realized that I did not really understand how they work. I just do not want to make that mistake again. Before I consider taking any more drugs, I want to understand more about how they work. The drug we're looking into is called Clomid. I asked my doctor a bunch of questions, but I still feel confused. I looked up some stuff online when I got home. Here is some information that I learned from a website about how orthotricycline works. Estrogen and progestin, the progesterones, work in combination to suppress the hypothalamic pituitary gonadal axis, or HPG axis. This suppression leads to a decrease in the release of gonadotropin releasing hormone, GnRH. I can see why she's confused. From the hypothalamus, and luteinizing hormone and follicle stimulating hormone, which are your two gonadotropins, from the anterior pituitary. Maturation of the dominant follicle is inhibited under the decreasing levels of FSH and LH. Hormonal contraceptive use also leads to an increase in the viscosity of the cervical mucus. Thickness, stickiness, basically, which inhibits sperm penetration and movement through the cervical canal. I am hoping that you'd be able to help me understand how these drugs actually work. All right, let's go back up to the beginning. Well, I don't care about the column part, but so here we have 26-year-old that's been trying to get pregnant for over 2 years, but before that, he was on birth control for 5 years. So just so you know, fiddling with hormones is not easy and should only be done under the supervision of a trained professional. So as we'll see in a little bit, birth control changes hormone levels in a way that fools your body into thinking you're pregnant. So you don't get pregnant while you're pregnant. So we'll talk about that. But just thinking that you can alter your body's hormones for 5 years and then just return to normal, it doesn't work that way. So you can, feel free to do some research on this, but there is something called post-birth control syndrome. So some people, their hormonal balance and their cycle and fertility will return to normal like almost immediately. Other people, it's months. Other people, it is years. And some people, it may never happen. So anytime you mess with the hormone, if you start taking exogenous hormones from outside your body, it's going to influence how your own body makes them. It's the reason that someone taking a whole bunch of steroids would lead, let's say it's a man taking a whole bunch of steroids, would lead to atrophy or shrinkage of the testicles because there's no reason to keep churning out testosterone if there's already 10 times too much there, 5 times too much there, whatever. So this is true with, I would say, any hormone, even looking at melatonin. For years, they thought melatonin was the exception, that taking melatonin to help you sleep doesn't affect your body's normal hormonal balance. But newer research has said that that's probably not true. So I'm not saying, and some would say it's certainly not true. So I'm not saying not to use melatonin if it helps you sleep. But I would definitely, if you ever plan on getting off of it, I would wean myself off of it and also be prepared for the fact that your sleep might suck while your body has to balance this stuff back out. So that's a really interesting topic, not for the scope of this talk here, but post-birth control syndrome. So like she mentioned, her periods were more regular when she was on the pill than when she went off of it. So she's gone off of this pill and she's just removed this massive source of female sex hormones, estrogen and progesterone, and her body is reeling, trying to figure out what to do. So it's going to have to kick back on its own normal production, its own normal rhythms and cycles, and that's going to take time. And like I said, that can take weeks for some people, months for others, years for others. So we're going to look at how birth control pills like orthotricycline work. Let me hit mute there. Sorry about that. And then we'll also look at how Clomid works as well. But that is something I definitely wanted to talk about before we get started. Just a little bit of an anatomy review here because I know how complicated this is. Most people know about estrogen and progesterone, progestin too, which are your primary female sex hormones. If you look at the menstrual cycle, estrogen dominates the first half of the ovarian cycle, and progesterone dominates the second half. But they're both very important female sex hormones. So hopefully you know what those are. Next, we have the hypothalamic pituitary gonadal axis. There are tons of axes the axes that start with the hypothalamus because that is your body. In a word, the hypothalamus maintains homeostasis. So there's the hypothalamic pituitary adrenal axis, which plays a big role in the stress response. Then the gonadal one, hypogonadal pituitary thyroid axis, you name it. But in this case, we're talking about the hypothalamus, pituitary gland, and the gonads. Let's start at the bottom. The gonads are the organs or structures in the body that produce the gametes, the sex cells. So when you think gonads, maybe you do think testicles, and that is true. The testicles are the male gonad. The ovaries are the female gonad. So in this case, we're talking about the ovaries. Then we have the hypothalamic pituitary ovary axis. The hypothalamus makes regulatory hormones. So the hypothalamus has many jobs, but one of its main jobs is to tell the pituitary gland what to do. So the hypothalamus will, in this situation, the hypothalamus will survey the environment and look and see how much of the sex hormones are there. If the gonads, the ovaries, are churning out estrogen, then the hypothalamus is going to say, we don't need more estrogen. If the hypothalamus doesn't sense enough estrogen in the area, it's going to prod the pituitary gland to tell the gonads to make more. So that's the role the hypothalamus plays. The pituitary gland, so the anterior pituitary gland, are going to be where your two gonadotropins come from. So the hypothalamus will send a signal to the pituitary gland with gonadotropin, as you can see here, gonadotropin releasing hormone from the hypothalamus will tell the pituitary gland to make follicle stimulating hormone and luteinizing hormone. Simplest way to look at this, F comes before L in the alphabet. E for estrogen comes before P, progesterone or progestin in the alphabet. So follicle stimulating hormone is going to lead to the production of estrogen, amongst many other things. Luteinizing hormone is going to lead to the production of progesterone or progestin, amongst many things. But that's the simplest way to look at it. So this axis is the hypothalamus is looking around. How much sex hormone do we have? How much estrogen is there? How much progesterone is there? If there's too much, it'll tell the pituitary gland to stop sending signals to the gonads. If there's too little, it'll tell the pituitary gland to start sending more. And you'll see that both the drugs we're going to talk about today, orthotricycline and Clomid, are going to interfere with this system. All right. What else is said here from her research? So we talk about the main players there. Maturation of the dominant follicle is inhibited under the decreasing levels of follicle stimulating hormone and luteinizing hormone. So normally, as we'll get into here, when you look at the hormone levels, when they start to drop, that's going to lead to one follicle becoming dominant and maturing and releasing an egg. So that's why normally in one ovarian cycle, one egg gets released, but we'll see how fooling that system with Clomid can actually lead to many follicles maturing and releasing eggs, which is why people that take fertility drugs like Clomid are more likely to have twins and triplets, etc. Okay, so I just, then to the mucus thing, their viscosity. Viscosity is basically how well a liquid flows. So if a lipid, think about water versus blood. Blood's about 5 times more viscous than water, which means it flows about 5 times less than water. Then imagine something like syrup or molasses being very, very viscous. So during the first half of the uterine and ovarian cycles, the cervical mucus is supposed to be thin so sperm can get through it. But in the second half, it's supposed to be thick to keep everything in. So we'll look at that role as well. All right, so that's kind of the preview before we. This is a deep concept, and the reproductive system is extremely complicated because not only is it hormones that matter, but the balance that matters and the timing that matters. So that's why I wanted to kind of do that quick introduction. So if you're one of my students, hopefully you've already been through that basic foundational stuff first. Okay, short answer questions. Number 1. In my research, I found that the levels of gonadotropins in the body are critical to understanding how the drugs Clomid and orthotricycline work. What are gonadotropins and what role do they play in fertility? So remember, the gonadotropins are going to be the two hormones made by the anterior pituitary gland that tell your gonads what to do. That's going to be follicle stimulating hormone and luteinizing hormone. So FSH, follicle stimulating hormone, and LH, luteinizing hormone. So they're called gonadotropins because they stimulate, growth and production of the gonads. So that is both male and female. So we're just going to focus on the female here. But just so you know, follicle stimulating hormone and luteinizing hormone are critically important in men as well. Simplest way to look at it is in men, follicle stimulating hormone leads to the maturation of sperm so they can mature, so they can actually do something. And luteinizing hormone will lead to an increase in testosterone production. But that's the last time we'll talk about the male. But so those are your gonadotropins. So the hypothalamus releases regulatory hormones that tell the anterior pituitary gland how much of these gonadotropins to release, and then they're going to then influence the gonads. So if you don't have the gonadotropins, then your gonads won't be doing anything. So think about a boy's testicles before puberty or a girl's ovaries before puberty. They're not doing anything because they're not being stimulated to do anything. So puberty is when you'd see a massive increase in these hormones and then also your male and female sex hormones. So one thing that I'll add here is we talk, the hypothalamus is the critical player here, but the hypothalamus is actually influenced by a hormone called leptin. So leptin is a hormone released by your body fat. You may not think of body fat as an endocrine organ, but it actually releases well over 100 compounds. And one of the big ones is leptin. So leptin tells the hypothalamus how much fat you have on your body. And this is the main reason. So for years, I always thought that the reason that a girl with maybe disordered eating, or she's a female athlete that's very physically active, very low body fat, the reason that she might start to lose her menstrual cycle or not even have it. So you'd have like delayed menarche would be not having your first menstrual cycle, or amenorrhea, secondary amenorrhea, which means you used to menstruate and now you don't because of low body fat. I just thought it was because, that low body fat just wasn't enough fat to go around, for these cholesterol-based sex hormones. But it's a little more complicated than that. It seems leptin's the key player. As your body fat drops too low, leptin gets really low. And then leptin tells your brain, we don't have enough fat to take care of us right now. Your body thinks you're in a famine, you're starving. So now is definitely not the time to reproduce. So you'll see that loss of menstruation is actually trying to protect you. If you don't have enough calories to survive, then how would you care for your offspring? So it's actually a little more complicated than I thought, but it is leptin that drives it. So there are other I'm just giving you an example of there are other things that can influence the gonadotropins and how they work. All right, number 2. Some of the references talk about how negative feedback is involved in understanding how these drugs work. Can you explain what is meant by negative feedback? So hopefully you have a pretty solid grasp of this. How I look at negative versus positive feedback is negative feedback is when there's a change in your body and the response is to try to change it back, to try to bring it back to normal. And that's almost every mechanism in the human body, because second by second we are alive because we can maintain homeostasis. What does that mean? We can maintain a stable internal environment. So if things change, that's generally not good because we were already in the environment where we're going to survive. Now, there are exceptions, and that's where positive feedback comes into play, where there's a change and your body responds by increasing that change. So think about, the stress response would be a good one, but the two biggest ones, the textbook ones, are always blood clotting. So a little bit of blood clotting leads to more blood clotting. So every step in the blood clotting pathway actually accelerates the next step. And the same thing with a labor and delivery. So once you start having a baby, every step accelerates the next one. So think about those are emergencies. Imagine if your blood started clotting and your body used a negative feedback system to stop your blood from clotting. Well, you'd bleed to death and be dead. Imagine you start having a baby and your body says, no, don't change that. Stop having that baby. That'd be terrible. But imagine if your blood pressure started to climb and got a little too high. And your body said, oh, you know what we should do? We should crank it up even higher. So that'd be a problem too. So you see that in case of, except for emergencies where things have to be done super quickly, your body's going to use negative feedback. So the textbook example is always going to be, the thermostat in your house. My heater just kicked on. I'm thinking I'm going to put a fan over that so you guys don't hear it. But So my thermostat is set at 66 degrees during the day. I like it cool. So that means that the sensor, the control center, just realized that it's not 66 degrees in this house anymore. It's 65. So the heater kicked on to try to bring the temperature back to where we want it, 66. So that's negative feedback. If it was positive feedback, which again we don't want in most situations, when that thermostat recognized the temperature dropped to 65, it had said, hey, let's make it colder, 64, 63, 62. So we don't want that. So that is negative feedback, and negative feedback is the foundation of most of the systems of your body. I'm gonna pause this for a second and cover that. Vent. Okay, number 3. My doctor told me that birth control pills contain small amounts of estrogen and progesterone, and these hormones prevent me from ovulating. I don't understand how giving me these hormones in a pill would prevent me from ovulating. I am assuming that it has something to do with levels of the gonadotropins that I asked about earlier. Can you explain this to me? So first of all, ovulation is when that the mature follicle with the oocyte, the egg in it, ruptures. So it ruptures out into the female reproductive tract, and hopefully, if you're trying to get pregnant, meets up with the sperm at the right time. So, all right. So here's how this works. If you give estrogen and progesterone to the body, remember, negative feedback would say, wow, now the hypothalamus is looking at this and thinking, we have too much estrogen and progesterone. So it's time for negative feedback to kick in. So the hypothalamus will stop sending gonadotropin releasing hormone to the pituitary gland, and can even send gonadotropin inhibiting hormone to stop it from working. So that the extra estrogen and progesterone floating around in the blood is going to tell the hypothalamus to then tell, remember it's an axis, so here's how the gonads are talking to the hypothalamus, which is talking to the pituitary gland. The hypothalamus is now going to tell the pituitary gland to stop releasing follicle-stimulating hormone and luteinizing hormone. You need follicle-stimulating hormone for the oocyte, the follicle to mature. You need a spike in luteinizing hormone is actually what causes ovulation. So if you have a bunch of these hormones around, then that's not going to happen. So it is true in a real simplistic sense what this girl, whatever her name is, mentioned earlier, that the birth control pill tricks your body into thinking you're pregnant, because that's what happens when you're pregnant too. The placenta is going to release these hormones, so you're going to have all these hormones in your body. Why would your body try to make you pregnant when you're already pregnant? So that is what happens. So because the birth control pill is basically artificially forcing negative feedback, which is lowering the gonadotropins, the follicle stimulating hormone and luteinizing hormone, the follicle will not develop and the egg will not rupture out of it. So you will not. That's why it prevents ovulating. All right, question number 4. In the information about orthotricycline, it mentions that the hormones in the pill make cervical mucus thicker and stickier. Does this happen during my natural cycle? How are estrogen and progesterone involved in this process? Real quickly, I want to mention as an aside that the antibiotic amoxicillin also affects cervical mucus. So I know several doctors that use amoxicillin, I think 5 days a month, as actually part of fertility treatments. So this is not the only drug that does that. Kind of an interesting example. Now, in my microbiology classes, I would talk about whether using antibiotics as a fertility treatment would be a smart use of antibiotics, but I digress. So let's talk about this. During a normal menstrual cycle, uterine/ovarian cycle, it's normally a 28-day cycle. So during the first 14 days, the mucus should be thinner and more watery. That's to allow for sperm to penetrate through it. And then in the second half of the cycle, so that's going to be dominated by estrogen. So hopefully you know by now that during the first 14 days, estrogen is the dominant hormone. And then we have this massive spike in luteinizing hormone around day 14 that causes ovulation. And then that causes your progesterone levels to be elevated. And when progesterone dominates in the second half of the cycle, the mucus is going to thicken up again. So does it happen during my natural cycle? Absolutely. And then how are these hormones involved? So estrogen is going to lead to a thinner, watery mucus. Progesterone is going to lead to a thicker, stickier mucus. So the first half of the cycle, you want sperm to get through. Second half of the cycle, if we've already had fertilization and implantation, you want things to stay in the uterus. All right, so that's a pretty simple question, comparatively, I guess. Number 5, my doctor also explained that birth control pills trick the body into thinking it is pregnant, which we've already mentioned so far. She explained that women do not normally ovulate when they are pregnant. Can you explain to me why a pregnant woman does not ovulate, and how is this related to how birth control pills work? So here's the key. When you're pregnant, you have a placenta. So we generally, people know what the placenta is, but we don't actually think about the fact that it's an endocrine organ. So the placenta is going to make estrogen and progesterone. And it does that because you need higher levels of those hormones to maintain the uterus. Because if those hormones were to decline in any other month after, during your cycle, that would lead to the body understanding that there wasn't a fertilized egg that was implanted, and that's what would lead to menstruation and the sloughing off of the uterine lining and then starting over next month. So these hormones have to stay elevated so that you have this big, thick uterine lining throughout the pregnancy. So it's also, so it plays a big role there, but it's also needed to tell the body, the rest of the body, to prepare for a baby. So you might see body fat changes, there's actually microbiome changes, but definitely you're going to see changes in the mammary glands, preparing for lactation. So these high levels of estrogen and progesterone coming from this alternative site, the placenta, are going to tell the hypothalamus, man, there's a lot of estrogen and progesterone around. I need to stop telling the pituitary gland to release, to stop releasing the gonadotropins. So that means the hypothalamus will quit producing gonadotropin releasing hormone and can even produce inhibitory hormones, so that the anterior pituitary gland will quit producing follicle stimulating hormone and luteinizing hormone, because they're the hormones that would lead to an increase in estrogen and progesterone. So the brain's already saying, man, there's too much of it, or there's enough of it already, no need to make any more. So without follicle stimulating hormone, you're not going to have the dominant follicle mature and then the egg rupture out of it during ovulation. That's the reason that a woman does not normally ovulate when they're pregnant. So is the doctor right that the birth control pills trick the body and think it's pregnant? Absolutely. So the birth control pills are going to give, similar levels of estrogen and progesterone that the placenta would make to fool the body into thinking that it is pregnant. So that's actually pretty interesting. Now, just again, we mentioned this before with negative feedback. This would be what happens if you take external sources of really any hormone. That's why it's, you have to be careful if you're working with hormones. I'm a big fan of the bioidentical hormones and making sure you're not taking too many of them, because if a man or a woman, but especially if a man is going to take a whole bunch of testosterone, the same thing would happen. And so now the hypothalamus would see all the testosterone out there and would say, okay, let's stop telling the pituitary gland to release follicle stimulating hormone and luteinizing hormone, which would lead to two things. We've already mentioned that without luteinizing hormone, a man isn't going to be producing as much testosterone. So there would the testicles would not be being told to make testosterone, which is why if a man takes high doses of steroids, their testicles will atrophy. So people talk about, if you ask the average person about testosterone causing the penis to shrink, well, that's not actually true, but it will lead to the testicles will shrink. They will atrophy because they're not churning out testosterone. But on the flip side, this is a big concern with taking high-dose anabolic steroids, because if you don't have follicle stimulating hormone, you're not going to have these nurse cells that are causing the maturation of sperm. So if a man takes too much testosterone for too long, it can cause fertility problems. So take a sip here. That's why, and I'm definitely not giving you advice on how to take anabolic steroids and still have kids, but this is why men will do things, maybe cycling the hormones, but actually now a big thing is taking alongside the anabolic steroids human chorionic gonadotropins. So HCG, maybe you've heard of the HCG diet, maybe you know that HCG is what pregnancy test is looking for. So when a woman is pregnant, they're producing HCG, but when men take testosterone and HCG, it seems to stop some of these negative feedback loops, so that a man that's taking testosterone can still produce functional sperm. So because if you do take high doses of testosterone, and even high therapeutic doses, not anabolic steroid levels, not performance enhancing drug levels, but if a man has hypogonadism and needs to take testosterone, it can affect fertility. So I think that's an important point. But I think that's aside from the point, but it's another really good example of the same thing. So maybe what HCG does in a man taking testosterone is trick the body, trick their brain into thinking that there's not too much testosterone. So that actually I would actually say that a man taking anabolic steroids and human chorionic gonadotropin, or HCG, would be more the equivalent of the drug in the next question called Clomid. So, but that's a very important example, and it is very relevant. Okay, number 6, 2 more to go. My doctor explained that Clomid works by tricking the brain into thinking that estrogen levels in the body are low. So whereas the orthotricycline, the birth control, is tricking the brain into thinking you're pregnant, so it doesn't try to make you pregnant again, Clomid actually tricks the brain into thinking there's not enough estrogen, even if there is. All right, she explained that this is what leads to the extra stimulation of the ovaries to encourage eggs to be released. One of the references for Clomid said this happens because there is less negative feedback. Can you explain to me how this trick and the decreased negative feedback are related? Why would these factors lead to the stimulation of the ovaries? Okay, so this goes along the lines of what we just talked about. So during the normal uterine and ovarian cycles, when you see a rise in estrogen levels, the hypothalamus and to some extent the pituitary gland would see that those estrogen levels are getting high. So the hypothalamus would stop telling the pituitary gland to release follicle stimulating hormone and luteinizing hormone. So that's how it normally happens. As estrogen levels go up, the counter-regulatory hormones, if you want to call them that, but the negative feedback system would say, okay, we have enough estrogen, let's stop making and releasing the hormone that leads to more estrogen. So that's normally what's going to happen. But Clomid is going to stop the brain, stop the hypothalamus and the pituitary gland from noticing that estrogen levels are high, which means the hypothalamus is going to keep releasing gonadotropin releasing hormone, which is going to tell the pituitary gland, the anterior pituitary gland, to keep releasing follicle stimulating hormone and luteinizing hormone. So that's why it says here, this is what leads to the extra stimulation of the ovaries to encourage eggs to be released. So normally, the encouragement, the hormones that tell these follicles to keep maturing and keep releasing eggs is going to be pretty limited, which is why usually, and this ties into the next question, this is why usually there's only enough hormone to go around for one follicle to dominate and become the mature dominant follicle, which means that in any given cycle, normally only one egg is going to be released during ovulation. So that's so the drug does, it tricks the brain into not seeing that estrogen levels are rising. And since it doesn't see that, it's going to keep telling the pituitary gland, make more FSH, follicle stimulating hormone, make more LH, luteinizing hormone. So that's how this trick is going to decrease negative feedback. And that's why the ovaries are going to be constantly stimulated instead of just temporarily stimulated. And then we back off as that single follicle usually dominates and takes over, which leads to question number 7. My doctor told me that if I take Clomid, oh, actually, no, I think there is more. I'm sorry. I was assuming there was only 7 questions, but this is not the one that I was thinking of. So my bad. I'm tired. My doctor told me that if I take Clomid, I will be taking it on days 5 through 9 of my normal menstrual cycle. She explained that this is when it will have the greatest chance of stimulating the ovaries. What is going on during this part of the menstrual cycle that makes it the best time to take this drug? So again, what you're seeing here is early, the first half of the uterine cycle and ovarian cycle is when estrogen dominates and when the follicles are being stimulated and matured. So days 5 through 9 will be the time when estrogen levels are rising to the point where normally your brain would quit producing follicle stimulating hormone and luteinizing hormone. So that's why it's going to have the greatest impact. Increasing estrogen levels after, the second half of the cycle, after that day 14, wouldn't do any good because the eggs that matured have already ruptured out. We've already had ovulation, and now it's progesterone's turn to take over. So that is going to be why this drug, because of its impact on estrogen, is only going to be effective if it's used in the first half of. Okay, so sorry about that. I forgot about question 7. Actually, question 8 is what I thought was question 7. So I read an article that mentioned that women on Clomid may be more likely to get pregnant with twins, triplets, or more. The article said that normally there is a single dominant follicle that releases a single egg, but Clomid can potentially make lots of follicles release an egg in a given month. How does Clomid do that? All right, let's start by talking about how it would do it and then talk about really how much more likely it is. I mean, many people have heard stories of people taking fertility treatments that lead to twins or triplets, and it is true that the odds are going to be higher, but maybe this would be a good time to talk about something like absolute versus relative risk. But all right, so remember what Clomid does. It fools the brain into not seeing all the estrogen that's around. So that means that follicle stimulating hormone and luteinizing hormone are constantly going to be getting churned out. So normally, as the negative feedback causes FSH and LH levels to drop, the follicles are going to have to fight it out and see who's going to be that one single dominant mature one. The other ones will degenerate. They're not actually going to be released. I mean, that's why, when a female is developing in her mother's womb, she has millions of these follicles and eggs, and she's never going to need anywhere near that much. So most of them are going to degenerate. So usually that one follicle is going to win out, and it's going to be the one to become the fully mature dominant follicle. It will rupture at ovulation and will have one egg. But with Clomid, you've got FSH and LH constantly being churned out, which means the odds that more than one follicle will mature and rupture and ovulate and leading to multiple eggs is going to be more common. So let's see. So some people that I've talked to have thought that these numbers are really high, but it just depends on how you look at it. Normally, I think somewhere around 2% of births are going to be twins, probably slightly less, slightly more, depending on the year. But from what I've seen, when you look at Clomid, the odds of having twins are slightly under 10%, let's say 8 or 9%, somewhere in that ballpark. So it is still a pretty big jump. If you think about from 2 to 8%, that does mean that your odds of having twins are 4 times as high. So that if I wanted to say a real sensationalistic number, that's what's called relative risk. So I would say and risk is a bad word if you want twins, but you'd have 4 times the odds of having twins. But if you actually look at the absolute risk, and again, risk is a bad word, but that's the words statisticians would use, you're going from 2 in 100 pregnancies to maybe 8 or 9 in 100 pregnancies. So, but it is way more likely, and that is, but it's not like half the people that use Clomid are going to have twins or triplets. So I don't know the numbers on triplets. I don't even know how common they are in the wild, if you want to say. So, but the odds of having triplets would be higher as well. As you can see, instead of a single egg being shot out, you've got multiple eggs potentially shooting out of the ovaries and heading down the uterine tube or fallopian tube, and that's how you're going to get the twins or triplets. Okay, so that is everything I have to say about this reproductive system case study, and I hope it is helpful. Have a wonderful day.